Also our testing numbers. I did want to talk for a second about testing. So, one of the things about testing is that it is a snapshot in time. When you get tested on a given day, you might be negative, but you might be early in the disease process and we haven't picked it up. It doesn't mean if you tested negative that you won't still catch it in the next couple days to come. So it's really important for those of us who get tested and find out we're negative. I don't want anyone to get a false sense of security from that. I want you to know that you still might be early on in the onset of disease and you might be carrying it still, and you might yet catch it. So it's really, really important that we understand testing for what it is. It is not treatment. Testing is actually the most important thing about testing is that when we find a case, it allows us to do that contact tracing, that investigation to see who you might be in contact with. And that allows us to stop that logarithmic spread. The most important thing about testing and why we're using our testing so judiciously is we want to break those chains of transmission. When you test positive, or even if we don't test you, we still treat you the same way. The treatment is not changed. But it's vitally important everything we're doing in Ohio is to figure out how to stop our spread of disease. And testing is just crucial for that. The way we will save lives in Ohio as we all move about more is to stop the spread of disease. And so you'll hear more about that in days to come. When you are tested or not, whether you've recovered or not, we don't know how long immunity lasts. So all the things we talk about that allow this economy to come back, to allow us to move about, means that we have to wear this mask and try to not spread it to others. We have to wash the hands. We have to say when we're sick. If our child is sick, we shouldn't take them to childcare. If we ourselves are sick and have a fever, we need to not go to work. These were the basics we learned in the beginning. They matter all the more now because what we're trying to do is increasing our moving about safely, but not have the chance of spreading it or having an outbreak. So really, it really relies on all of us doing our part. The next thing I want to say is a little bit about the antibody testing. We're very excited. I know some news stories have run that in the next weeks we will be doing some testing throughout Ohio. This is voluntary. We're starting with a random sample that represents all of Ohioans. So it'll be 1,200 samples taken, 1,200 people who volunteer, but they represent all of us. They're volunteering to help us learn more about the prevalence of this disease, many of whom may not know they've already had it. So we'll be sending out a postcard that will be followed out to citizens with a letter, and ultimately someone who would actually come to their house and test someone 18 years of older in the house. We'd learn a lot about you, and we'd actually take a nasal swab and do a blood test. And this will be all over. It will be urban. It will be rural. Again, voluntary participation in a study that helps us learn more about coronavirus in Ohio. So we're very excited about that. It would never have been possible were it not for NetJets and Celix and the work of whole teams of scientists around the state who are working together with healthcare providers to help us learn more about this disease.